Hello, sir. How you doing?
I'm doing good.
My name is Syria, and I'm a nurse here working with Dr. Owen, and I'm going to be doing a focused lung and thorax assessment. And can you tell me what brought you here today?
I'm here for a physical.
Physical? Okay. And have you had any breathing problems recently?
No.
No? And have you noticed any changes in your breathing in the last 2 weeks?
No.
Last 2 months?
No.
Last 2 years?
No.
Okay. All right. So can you tell me, are you a mouth breather or a nose breather?
I like to think both.
Both? Okay. That's fair. Okay, sometimes all of us are a little bit of both. And how would you describe your breathing?
Normal.
Okay. Have you noticed if you're having problems sleeping at night or breathing when you're trying to go to sleep?
No.
Okay. And do you have any allergies?
I have seasonal allergies.
Okay. Have you, do you have any illnesses or are you sick today?
No.
Do you have any medical condition that I should know about?
I do have asthma, but it only flares up when I exert myself at the gym.
Okay. All right. Do you smoke?
Yes.
And how much do you smoke?
About a pack a day.
Okay. Have you had your flu vaccine this season?
No.
No? Okay. Any other disorders or illnesses?
No.
Okay. And any type of, and would you want to have a flu vaccine today?
Yeah.
Okay. All right. We can arrange this. All right. So now I'm just going to ask you some questions to establish a baseline. Okay. Can you tell me your full name?
Richard Cousins.
And your date of birth?
January 20th, 2000.
Okay. And do you know where you're at right now?
Dr. Owen's clinic.
Yes. And do you know the day of the week?
Tuesday.
And do you know the date?
4/20/21.
Do you know what these are?
Glasses.
Do you know what they're used for?
C.
Yes. Do you know what 6 times 4 is?
24.
And would you understand what it means when somebody asks you, why is it better to have one bird in your hand than 2 in the bush?
I think it means it's better to hold on to what you have than to let it go for something that may or may not be.
Okay. So now I'm gonna start the assessment. I'm gonna get your blood pressure and get some your oxygenation. Okay. Okay. All right. Take some blood for me. Start it. So your oxygen is at 100%. It's good. Blood pressure is 111 over 76, and your heart rate is 55. And while we were getting your blood pressure, I was counting your respirations, and you're at 12, which everything is normal. Looks good. All right, so now I'm gonna go into the lung and thorax assessment. Can I please have you take off your shirt for me, please? Okay. Okay. So right now is the inspection of the chest and thorax. So all I'm looking at is your skin and looking for wounds, scars, just watching, just seeing how it looks, and I'm also looking at how you're breathing. It looks even. You don't have to take any deep breaths. Now, can you give me your hand? I'm gonna look at your hands, and what I'm checking is the capillary refill. So when I press on your nail, it goes white, and then when I release it, it goes red. So when that happens within less than 3 seconds, that's normal. That means you're getting adequate oxygenation. I'm also looking for any clubbing of your nails or any other abnormalities, which there's nothing. Everything looks normal. Okay. And I'm also looking at the shape of your chest. There's no barrel chest, and no asymmetry. Everything's even and balanced on both sides. So now I'm gonna palpate your chest, and then you tell me. What I'm doing is I'm checking for lumps and any masses, or you tell me if you have any pain also. That's also what I'm checking for. Any nodules? Anything hurt anywhere?
No.
Okay. And could you stand up for me? What I'm gonna look at now and turn this way. I'm gonna hold on to your back, and then I just need you to take a deep breath. I'm looking at your lung expansion. So what I'm checking for is that there's even bilateral, not one side stayed down while the other one moved, and yours are even bilateral and equal. You can have a seat now. And then now what I'm checking is for I'm palpating your lungs, and then I'm in the intercostal in between the ribs, and then you just say 99.
99.
And then what I'm checking for, keep saying it. I'm checking for any dullness
99.
or hyperresonance.
99.
And there's
99.
it's good. Okay, now I'm gonna palpate. So now I'm gonna percuss. So I'm checking for any dullness or resonance, and then what this tells me that since there is none, that your lungs don't have any. And take a deep breath. Hold. Take a deep breath. Hold. Okay, you can release. Take a deep breath. Take a deep breath. And hold. Okay. Take a deep breath. Do one more time. So that tells me it's within normal limits. There's no dullness or hyperresonance. So that tells me you don't have any pleural effusions or lung consolidations, things like emphysema. So everything's clear on that part. So now I'm gonna auscultate your lungs. This is where I'm listening to your breath sounds. And then whenever I touch, you just take a deep breath, okay?
Okay.
Okay, now I'm gonna do the sides, and you can take this, hold your shoulder, and then take a deep breath. Okay, and now we're gonna switch arms. Put that. I'm gonna come over here, take a deep breath. Okay, and then you can put your arms down. And now I'm gonna do it again. Just take a deep breath every time I touch. Okay. And now I'm gonna do a sound test on you. And every time I touch you, you're gonna say 99.
99. 99. 99. 99. 99.
Okay, now I'm gonna come from the front.
99. 99. 99. 99. 99. 99.
Okay, so I'm also looking for consolidations or any fluid buildup. So that the 99 is soft, and so that tells me it's within normal limits. So now I'm gonna ask you every time I touch to say the letter E. Mm-hmm. 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 Okay, and I'm gonna do it from the front. Mm-hmm. 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 And this is also checking for consolidation. I heard like the E sound the whole way through. If it would have changed to A, that would have be an abnormal finding, because then you would have had fluid building up. But everything's normal, you don't have that. Now this time when I touch you, you're gonna whisper 1, 2, 3. Okay, now I'm gonna come from the front. So this one is also checking for pleural effusions and consolidation. So I can see your lips moving, very faint. I couldn't hear it, but very faint sound. So that tells me you're within normal limits. There's no consolidation or fluid buildup. And now I'm just gonna feel your clavicles. Okay. The supra. So I can teach them to you. The suprasternal notch. And then we come down here is the angle of lowest. The costal angle is right here. And then I'm gonna check for C1 and T1. So the way I check, I have to check the most prominent vertebrae here. So what helps me is when you bend your head down, and then there's C1. That one moves, and then T1 is right under it. T1 will not move because it's attached to the ribs, where C1 will move, and it's right in the place. Now, if you can stand up for me, and I'm just looking for evenness and normal, and making sure there's no scoliosis, lordosis, or any protrusions up here. But yours is equal bilateral, and it looks good. And then bend over for me. And come back. It looks good. All right. And you can have a seat again. All right, so when I was looking at your thorax and your skin, everything was normal, pink. Capillary fill was within 3 seconds, quick, no clubbing, no discoloration. The thorax was no barrel chested, everything was normal. Your breathing was even unlabored. There was no nostril flaring, so that tells me you're breathing within normal limits. Everything looks good. The movement of your chest is symmetrical. When I palpated your chest and thorax, I didn't feel any nodules or lumps or any deviations. Everything's normal. When I percussed, there was no dullness or hyperresonancy. Everything was in normal limits, and your diaphragmatic excursion was no dullness or flatness. And then when we were getting you to breathe in, I was holding my fingers or my thumbs. Everything was even, so everything's good there. When I was auscultating your breath sounds, over the vesicular areas, the sounds were soft and low pitch, and I mainly got those from the back. In the front, the bronchovesicular sounds were medium pitch. Everything's normal. The bronchial sites are also normal. No adventitious breath sounds or wheezing. Nothing crackles. Nothing abnormal. And the tracheal sounds higher. They're usually more harsh and high pitched, but that's normal. So I didn't hear a tracheal sound down in the lower lobes. Everything was within limits. Okay? And then for the teaching is, I know you're trying to quit smoking, so we got a program. We'll get Dr. Owen to prescribe a medication, and then you'll keep smoking for 8 days. You take your medicine, and then on the 8th day you stop. We'll go over all the teaching, give you the dose and everything and all the information on that. And then we'll encourage you, we'll follow up. For wheezing, I know it's only if you're working out. It could happen and even when you're not working out. Always carry your inhaler. Make sure you're not flaring or breathing faster. And if you ever have questions, just give us a call, okay?
Okay.
All right, thank you, Mr. Cousins. You have a nice day.
Okay.
All right, take care.